Hello, I'm Trevor Petrie. I'm a certified hand therapist and I've been working in hand therapy for 7 years. Thumb pain can be caused by a whole host of different possible diagnoses. Injuries would be the most obvious. Obviously, if you smash your thumb with a hammer, that's going to cause thumb pain. With most people that come in, there are two main causes of thumb pain. One is tendonitis of those tendons that run up the back of the thumb right here, called de Quervain's tendonitis, or also known as mommy's thumb. New mothers or pregnant women will oftentimes develop tendonitis of those structures right here at the base of their thumb. And the other most common cause for thumb pain is CMC osteoarthritis, or arthritis down here at this joint of the thumb. The reason so many people wind up with thumb pain is because we use our thumbs a lot. And because we use our thumbs a lot, we tend to wear out the parts that make up our thumb. The other thing that happens is our thumbs are pretty amazing. They can move in all kinds of different directions, and there's several reasons for that. There are 9 different muscles that move your thumb in fun ways. They have to cross over multiple joints to move the thumb in those cool ways, which means that in different positions we put a lot of different stresses on all of those muscles and structures and tendons. The reason that our thumb can move in all kinds of fun ways is that the joint here at the base of the thumb is what's known as a saddle joint. So you have a little bone that lives right here called your trapezium, and it makes the saddle just like this. It's like a little U shape this way, and then it goes like this in the other plane. And then you have this longer bone called your metacarpal bone, or your first metacarpal bone, that sits right on top of that trapezium, or that saddle joint, like a cowboy sitting in a saddle. The problem is I can't even make my thumbs go wide enough to show how shallow that saddle is. It's a very shallow joint. There's not a lot of bony hold of that joint to keep those bones from slipping and sliding. It's all ligaments, soft tissue. So if you have very loose ligaments, if you've got a lot of motion and a lot of other ligaments, and this is why women are a little bit more prone to osteoarthritis of this joint than men, especially as they age. What happens is, instead of rolling and gliding nicely on that joint, that metacarpal bone, this bone right here, tends to slide and shear like this. And so over time, that irritates the joint, which is where the itis part of arthritis comes in, at that particular joint. And then you start breaking down the cartilage of that joint, and then you start developing bone spurs and deformities of that joint. And that's what causes pain, and that's why this is so prevalent. It allows us to do so many different things, but because of how cool that joint is and how cool our thumbs are and how they can move in all different ways and allow us to do so many different things, that's why it is also so prone to pain and injury, and especially arthritis and tendonitis at that area.